Welcome back to chapter 13, everyone. This chapter is entitled The Spinal Cord, Spinal Nerves, and Somatic Reflexes. This is the second part of the chapter, and let's go ahead and let's continue to explore the spinal nerves a little bit more. All right, so in part one, we discussed exactly what a nerve was, the fact that it was an extension of an axon, and how you have your posterior ones that are more for the sensory, and you have your anterior ones that are more for the motor / target, and of course you have your interneurons in between that allow for the communication with the peripheral nervous system and the central nervous system. Now, in this second part of the chapter, we're going to go ahead and take a look at the different pairs of spinal nerves. And in here, we're going to go ahead and concentrate on the fact of where they radiate outwards from the spinal cord and which parts of the body they will be responsible for monitoring. So on your screen, what you're looking at is the fact that there are 31 pairs of spinal nerves. These are all mixed nerves, meaning a combination of sensory and motor, afferent and efferent. And within those 31s, we can go ahead and subdivide 8 of them for the cervical region, so that's going to be the neck region. The first one of these is going to come directly out of the skull, in fact, between the skull and C1, or your atlas bone. The other ones will all exit out of the intervertebral foramina. The intervertebral foramina is the cavity that's created when you stack together your vertebra. It has a small little opening that will exist on either sides of the vertebra, and that is then where the nerves will radiate out of. You actually saw that term when we were doing chapter 8, and we were exploring the different bones that we have in our body. All right, so 8 spinal nerves in the cervical region. You're going to have 12 of them in the thoracic region. And notice how they are going to be labeled, doing very similar to the vertebra when we were learning the bones, in the fact that you're going to go ahead and have your T1 and up to your T12, T indicating the thoracic. And then, of course, we're just counting them down. The first one is 1, followed by 2, all the way to 12. In the lumbar section, you will have 5 spinal nerves that will radiate out from the intervertebral foramen. Sacral will have 5, and in the coccygeal, or by your coccygeal bone, will have 1. So please make sure that you can do the breakdown. So 31 spinal nerves altogether, 8 for the cervical, 12 for the thoracic, 5 for the lumbar and the sacral, and 1 for the coccygeal. Now, because we have so much other detailed information to get ready for our upcoming exam, what I will tell you is that in a little bit, I'm going to show you the individual nerves, just so you can kind of see how they radiate out of the body, but you will not have to individually be able to identify them. You're going to have it within your homework assignment that you'll be labeling the nerves, so you'll become more familiar with it. But for exam purposes, I will not ask you the individual nerves, so you just want to know quantitatively wise how many are in each region. So 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, 1 coccygeal. All right, so here's just a reminder of what we're talking about when we talk about our nerves. And remember, we said that the spinal cord, which will run within the vertebrate column, it will end around L1, where you have your medullary cone, and then you can see that it's radiating on either sides. And these are all going to be the nerves that we're looking at, and we're going to be exploring them, getting to know them a little bit better as we move from the cervical section all the way down to the coccygeal nerve, where you just have 1 pair. So look on the side right here, you can see cervical nerves, 8 of them. Thoracic will have 12, lumbar 5, sacral nerves 5, and coccygeal 1. Okay? Here is another look at what they like to call the branches of the spinal nerve. So in part 1 of our discussion, we talked about the fact that you have your spinal cord right over here. Remember, we talked about the meninges, right? Your dura mater, your arachnoid mater, your pia mater. And then we talked about how the nerves will radiate outwards. And the ones that are on the posterior side, those are all about sensory system, and that it's moving upwards, ascending, so it can travel up the spinal cord over to the brain, and we can do our interneurons connection. And then the anterior side is all going to be dedicated to reaching the effect. It's going to be descending, so you're over controlled to whatever type of motor or target cell you're trying to reach due to the stimulation that was being caused by the posterior end. So posterior sensory, anterior is going to be more motor / effect. All right, here's just another look at the Rami, or the branches of the spinal cord nerves. The reason I like to keep adding these pictures is just to kind of show you that even though the spinal cord doesn't run the entire length of the back, because of the fact that it has this extensive network of nerves that radiate outwards, it really does allow for the monitoring of the entire body of both the sensory, the interneuron, and the motor system aspects of the nervous system. So you can literally see how the nerves just wrap around and they literally cover the entire entity of the body. It's a very effective way of communication and allowing for a full sensory system as well as an effect to occur within this relationship. All right, so let's go ahead and let's take a look at the cervical plexus. So in the cervical plexus, what we see happening is that we're going to be looking at nerves that are radiating out from the neck. So here you could just see some of them that will be connecting. We could see that we have our occipital nerves that will come out of it. Some of the cervical nerves will be labeled based on their anterior and posterior roof. And then, of course, they have the phrenic nerve that's highlighted here as well. Now, once again, please do not worry about memorizing these nerves individual. You just kind of want to take a look at what is happening, and this is more for an illustrative example to see how they're radiating out and they start interacting with their sensory and motor addition. Next is a look at what we like to call the brachial plexus. Now, the brachial plexus is going to go ahead and take a look at the interaction between mostly cervical as well as one thoracic nerve. And what's happening here is this gets its name because it's going to go ahead and move down the arm to allow for the full sensation down the arm. And as you can see, the same collection of nerves will often change their name, or I should say the certain subsections. Oh, I couldn't say that word crooked. Certain subsections of the nerves will change their name depending on the location where the nerve is actually coming through. So you can see as the nerve passes through the armpit, we have the axillary nerve. Then you have the medium nerve as it's moving more towards the midpoint of the body, and then the radial nerve as it's radiating more towards the outside over to the side of the radius. In fact, if you move it down, you can see how you have your ulnar nerve and your radial nerve. And this split thing just basically makes sure that the entire upper appendage is well taken care of and allowed for interaction between the nervous system as well as any type of stimuli that's occurring both outside and inside of the body. Something that I just quickly want to show you real quick is notice how you have your nerves that run very close to the condyle and the epicondyle of your elbow joint. And this is one of the reasons why if you ever hit your arm on that little inside part of the elbow, how it's very painful, and they'll say to you, oh, you hit your funny bone, right? Because the humerus, haha. But either way, that's due to the fact that the nerve runs so close to the skin surface, making it very sensitive in that area. How about this one? This one's taking a look at the lower appendages, and we have what we like to call our lumbar plexus. So by now, hopefully you'll see that plexus are just a collection of different nerves that will kind of have a different origin and will radiate all towards one particular section of the body. For the lumbar plexus, we're taking a look at L1 through L5. And as you can see, they will radiate down the leg, once again, often changing their name of the nerve depending on its anatomical location. I do want to point out the longest nerve that we have in our body, and that's our sciatic nerve right over here. And as you can see, it's making its way down from the hip bone down to the femur. The sciatic nerve is the longest nerve, as I was mentioning to you before. People will complain of their sciatic nerve for many different reasons. For instance, studies have shown that drastic weight gain can put pressure on the sciatic nerve, getting you the uncomfortable pinching that you might have in your thigh or your hip area. I remember reading an article that said that if you have If you're wearing jeans or any type of pants that have back pockets, you want to be very careful not to kind of put a lot of entities in your pocket, because then when you sit, it makes it an imbalance, and that can actually cause pressure on your sciatic nerve. So for instance, guys, if you carry your wallet in your back pocket and you notice that you start getting a pinch in that leg, it could be due to the fact that the wallet is causing improper alignment, and that can cause the pinching of the nerve to occur. Just a little FYI. All right, here's the sacral and coccygeal plexus. And once again, we don't have to worry about memorizing the individual names of the nerves. This is just to give us a nice little overview of how they radiate out from the spinal cord and how they're able to kind of embed and encompasses the entire body by collectively working in the anterior and posterior end of it. So this particular part of the lecture is really just kind of a lot of looking and just a little FYI along the way. All right, so let's take a look at what we call a dermatome map. A dermatome map is basically a representation that will highlight which parts of the region of the body a single nerve covers. So for instance, if you take a look at the illustration, you're going to notice that the different categories of nerves, cervical, thoracic, lumbar, and sacral, they have each been given a color code, and you can find those different color codes located on our little male specimen here. And what the dermatome map will do is it will basically showcase which nerve covers which part of the body. Now, the reason this map is so important is because if you're trying to apply local anesthesia, you want to know exactly which nerve you have to numb so that you can maximize your results. So oftentimes the dermatome map will be utilized to figure out the maximum amount of anesthetic without giving the maximum dosage of the drugs, so that they can have more of a generalized effect. Usually what they'll do is that they will overlap some of the maps. So for instance, let's say we need to make a tiny incision in the abdomen, and that would involve the T10. What you would see is that the anesthesiologist would go ahead and encompass calculations to numb both T9 and T11. Because once again, with the dermatome map, this is a rough estimate, and each of our bodies will have slight variations when it comes to the nerves, as well as with most of our organ systems. All right, now the last part of the chapter is going to take a look at reflexes. And the reflexes, as I mentioned to you in part 1, these are going to be very quick involuntary responses. In your notes, it says that they can also be classified as stereotypical, meaning that they will always be the same. It can involve glands, it can involve secretions, it can involve muscles contraction. But either way, what we see happening is that when you look at a reflex, you want to remember 4 things. The first thing is that it will always require some type of sensory input. So it will require stimulation. It will just not occur out of the blue sky. It will require stimulation. It is very quick, and part of that is because usually there is a short path between the sensory and the motor effect. We can say that, for instance, it uses few interneurons and minimum synaptic delay, meaning it has a very short pathway from beginning to end, and that's why you get that quick response. They are involuntary, meaning that on a conscious level, you can't really control them or suppress them. When they are activated, they are activated. And once again, they're stereotypical because they will always occur in the same way once activated over and over again. So they require stimulation, they are quick, they are involuntary, and they are stereotypical in their response. Now, keep in mind that with your reflexes, these stereotypical motions can do anything from secretion to actual contraction of any of the muscles, really. The cardiac muscle, the smooth muscle, or the skeletal muscle. So let's go ahead and let's explore some different examples of reflexes. One of the ones that always gets discussed is the patellar reflex. So if you've ever gone to the doctor to get a physical, part of what they'll do is they'll kind of test your reflexes. So they'll have you hop on top of the little examination bed, and right underneath your kneecap, the doctor will take the little hammer and they'll give you a little smack and your leg goes flying without you even noticing it, right? You didn't even have any control over it. That's a perfect example of a reflex. So this is an example of a reflex arch, and it basically shows the quick communication between the stimulus and the effect. And notice how there are some markings on here that you should be familiar with, right? So for instance, we can see that we have our afferent sensory nerve vern. Notice how that is on the posterior end, right? There's our posterior ganglion. It's going to go ahead and connect and quickly synapse with the integrating center. And then what we see is it's going to travel down, so descending through the motor side, which is of course the anterior or the ventral side. And as you can see in this case, the efferent for the effect will quickly connect to the quadricep muscle, allowing for the leg to go swimming outwards whenever the patella is properly hit right underneath it. And this reflex is an example of the fact that once stimulated, so once you hit it in the right spot, you will always get a stereotypical response. And you often will do this without even having the hint that your leg's kind of flying forward. So there really is no way to kind of compress it or suppress it or stop it in its way. So here's just a quick reminder of, remember when you take a look at your skeletal muscle, that it does require the innervation of the nervous system. So they've just gone ahead and just kind of show you how the muscle spindle is in full communication with the sensory and motor nerves, but more particularly with the motor nerves if we wanted, of course, to contract. This is like FYI. And then notice how you have the myelinated axons making their neuromuscular junctions. Now, if you wanted to explore the individual steps of the patellar tendon reflex, go ahead and take a look at figure 13.22. This one is just a little informational slide. I will not be asking you for the individual steps on your exam. I will just ask you in essence what a reflex is and to be able to explain it. But once again, very similar to the initial picture that we saw, what we see happening here is that there is a quick communication between the sensory, the afferent, and the motor or efferent nerves, allowing for that foot to go swinging. Another interesting reflex that I do want to bring up as well, and I mentioned this in part 1, is what we call the flexor and cross extension reflex. This reflex comes into play whenever we step on something that's really sharp or could be dangerous. So we want to kind of lift our leg out of the pathway of harm. So here, for instance, we have an individual. Let's see, it seems like he was at the beach. He was walking in the water, and he just happened to step on something that is sharp, a piece of glass, and the minute that reflex, that stimulus is detected, your reflexes are going to respond by allowing the leg that's been injured to lift up. So we're going to see that we have our little flexor that's going to contract, and the leg is elevated, so that way it's out of harm's way. Now this is the withdrawal of the right leg, because that's the one that was injured, right? Now, here's where it gets interesting, because at the same time as you are withdrawing the right leg, you want to keep in mind that as you're doing that, you're shifting your body weight. So you don't want to fall over. So what we see happening in the flexor and cross extension is at the same time that the injured leg is withdrawn, we see that there will be an extension reflex on the uninjured leg. So for our example, that would be the left leg that will go ahead and do an extension. And when it's doing its extension due to the response of the motor neurons, we see that the leg will go ahead and straighten itself out. It will contract its muscles so that it's able to completely support the body weight, and therefore you don't fall over. Isn't that cool? So you have your withdrawal, which is to remove yourself from injury, and then you have your cross extension to accommodate the shifting body weight. And once again, this is an involuntary, stereotypical response that as soon as the stimulus is detected, will cause the same effect to happen over and over again. And part of why the reflexes are so quick is because there really are just a minimum amount of interneurons that are connected, so that way you can go from sensory, afferent, to motor, efferent extremely quickly and get the response that your body desires. Alrighty, so as you can see, part number 2 was a quick one, but as always, if you have any questions, comments, or concerns, please do let me know. Alright everyone, we shall talk soon.